either session. All right, welcome everyone to our member education for 2025 annual enrollment. Thank you so much, Tony Marie, for being with us, and I turn it to you to get us started.
Thank you, Samantha. My name is Tony Marie Sutliff, as Sam said, and I work for the Church Pension Group, have been with the Church Pension Group almost 16 years, and I work from my home in Salt Lake City. It's always a pleasure to come to Los Angeles because you have such beautiful weather here and such good food. I'm going to spend the next few minutes going over your benefits for 2025. Most of them are not changing. So I'm going to go very quickly through what is not changing and spend some time on what is changing. But I do want to remind you about the benefits that you have now and that you will continue to have next year, regardless of the plan you choose. Then I'll spend just a couple of minutes reminding you how to do your annual enrollment. And finally, we'll take any questions at the end. So the Church Pension Group is providing the same plans next year that we're providing this year, and the diocese is making available to all the employers in the diocese the same plans. It is up to each employer, whether it be church or school or other institution, to decide which plans it is willing to pay for. And if you have questions about that, you should talk to your benefits administrator or call the diocesan office. But I'm going to quickly go through each of the plans that are offered so that you understand how they work. And if you have to make a plan change, you'll know how to evaluate that. There are three different kinds of plans. There are PPOs, which stands for Preferred Provider Organization. There are EPOs, which are provided only through Kaiser. And those, you have to go to Kaiser. It's an exclusive provider organization. And then we have consumer-directed health plans. We call them CDHP. You also may have heard of them as high-deductible health plans, HDHP. Preferred Provider Organization plans, or PPOs, are provided through the Anthem network. What preferred provider means is that you can go to any doctor you want, any hospital you want, any provider at all that you want, but you will pay less if you go to a provider that is in the Anthem Blue Cross Blue Shield network. You can go out of the network and you'll get the same benefit, but you'll pay more. EPO stands for Exclusive Provider Organization, which means you have to stay in the network. Excuse me. If you are familiar with Kaiser, if you're in a Kaiser plan now, or if you've ever been in Kaiser, you know how it works. You have to go to Kaiser Permanente providers and facilities, and you must choose a primary care physician who will really help you manage your care. The third kind of plan is a consumer-directed health plan, and we provide those both through the Anthem network and through Kaiser. The difference between our PPO or EPO plans and these consumer-directed health plans are primarily that there is a high deductible. That's why it's called a high deductible plan, meaning that you have to pay more out of your pocket before the plan starts to pay its share of the cost of your coverage. Now, what makes this work is that once you are enrolled in a CDHP plan, you can have access to a health savings account. You'll hear us call them HSA. The health savings account is a way for you to set aside money to help you pay for those out-of-pocket costs that you need to pay for to get to this little bit higher deductible. And I'll give you a little more information about that. If you've never used one and are interested in enrolling in it, I want to tell you how this works. The health savings account is a really important savings vehicle because it has three different tax advantages. First, any money that goes into the account is tax-free. That means if you put money into the account of your own, you put it in before you've paid taxes on it. So it's tax-free money that goes in there. If your employer puts money into the account, and your employer should put money into the account for you, you don't pay taxes on that. That's tax-free money. That's free money. that your employer is giving you. And then while the money is sitting in that account, any interest that it earns, you're not paying taxes on. Then finally, and even maybe the most important part of this, is that when you use the money out of this account, if you use it for qualified medical expenses, you don't pay taxes on it. So it is never taxed if you use it appropriately. It is never taxed. The other really important item is that once the money is in your account, it is your money. It does not go away if you don't use it. It will continue to remain in your account. And if you continue to make contributions or your employer makes contributions, it will continue to accumulate interest and grow over the years until you need it for something, especially once you get to retirement. If you have a chunk of money in your account, you can use it for your qualified medical expenses in retirement. And as I said, it's your account, it's your money. So if you leave your employment, you can take it with you and you can continue to use it for qualified medical expenses for the rest of your life or until it's gone. So how much money can you put in there? The amount changes every year, goes up a little bit every year. The IRS issues regulations that tell us what it will be. In 2025, the maximum that can be put into the account on this pre-tax basis is $4,300 if you are enrolled in an employee-only plan. That's a combination of what you put in and what your employer puts in. If you are enrolled in a family level plan, the maximum that can go in on a tax-free basis is $8,550. Family level plan means you and any dependent. So you and one child, you and all your children, you and your spouse, you and your whole family. You are enrolled in a family level plan and you can put in up to $8,550 during 2025. And once you reach the age of 55, you can put an additional $1,000 a year into the account. So you can see if you're not spending it, if you don't need to spend it, it's going to accumulate to quite a large sum of money. So that you understand how to compare plans, I want to teach you a little bit about insurance speak. You're going to become the expert and you can help all your family and friends. These are the 4 most important things you need to understand about any insurance plan anywhere. First, there is the deductible. And you're probably familiar with deductibles. If you have a car with an insurance policy on it, it has a deductible. That means you get in a car accident, you first pay the deductible amount, the first $500, for example, if that's what the plan says, and then your insurance policy kicks in. It works the same with medical plans. There will be a deductible, and that means you're going to pay the first whatever cost of your services until you reach the deductible. And it's not the 100% of the cost that a doctor or a hospital would pay, or I'm sorry, would charge to someone that doesn't have insurance at all. It's the negotiated cost. It is the cost that the doctor or the hospital has agreed is a reasonable amount to charge so that they can be part of the network. So you're going to pay 100% of that cost until you reach your deductible, and then the plan begins to kick in its share. Actually, the most important item to understand is out-of-pocket limit. The out-of-pocket limit is the maximum amount that you're going to pay for your care during the calendar year for expenses that are covered by your plan. So if your out-of-pocket limit is $3,500, for example, once you have paid that out of your pocket, then the plan is going to pay 100% of your covered care for the rest of the year. Now, and that's probably the most important way to compare plans. What is the out-of-pocket limit? The way you actually pay your share is either through a copay or through coinsurance. A copay is just a flat dollar amount. You may have a $30 copay for an office visit, for example, or a $250 copay for an emergency room visit. That copay is what you pay. And you don't have to worry about deductibles when you have copays. That means, for example, on January 2nd, you think you're coming down with the flu, so you go to your doctor. You probably have not met your deductible on January 2nd, but it doesn't matter because if your plan says you pay a $30 copay, that's what you pay, is your $30 copay. The other way that you can pay for service is co-insurance. And this is when the plan says that you and the plan share the cost of your service in percentages. So if you are in a PPO 80 plan, for example, that means the plan is going to pay 80% and you are going to pay 20% once you reach the deductible. When you have co-insurance, generally you reach the deductible and then you start to pay your co-insurance. So if you understand all of that, you really understand how plans work. So let's take a quick look specifically at the plans that are offered so that you can understand what I've been describing. This is our most benefit-rich plan. It is the Anthem PPO 100. The 100 means, excuse me, that the plan is generally paying 100% of the cost of your care, except for some copays. The PPO means that you have network benefits and you have out-of-network benefits. So I just want you to take a minute and look. If you go out of the network, you can see that the cost is going to be higher for you. You get the same coverage, the same services are covered, but you're going to pay more if you go out of the network. So I'm just going to focus on the network side. You can see there is no deductible. Why? Because there's no co-insurance. It's all copay. And there's a $2,000 out-of-pocket limit if you're enrolled in an individual plan. Now notice the office visit copays. These do not change in our PPO plans. You pay $30 for your primary care, $45 for your specialist. And with all of our plans, regardless of the plan, you do not pay for your preventive care. That's your annual physical, those age-appropriate tests like mammograms and colonoscopies, and your vaccinations. And then you can see there are copays for some other services down there. So that's the PPO 100. Let me show you. The next one is a PPO 90. The PPO again means network, out-of-network services. The 90 means that once you reach your deductible, the plan is going to pay 90% and you're going to pay 10%. So you can see there's a little deductible here. The out-of-pocket limit is a little higher than the other plan. The office visit copays are the same. So these plans have those copays exactly the same. But you can see once you get down into hospitalization or surgery, there's co-insurance, meaning that you're going to pay 100% of the negotiated cost of your service until you've reached $500. And then you're going to start paying your 10% co-insurance. And that is, of course, until you reach your out-of-pocket limit. So, which is $2,500 here. So an individual in this plan can budget for never having to spend more than $2,500 for covered medical care in a calendar year. So let's take a quick look at the next one is our PPO 80. And now you understand PPO means network and out-of-network benefit. 80 means that once you've reached your deductible, the plan's going to pay 80% and you're going to pay 20% of the costs. But see, the office visit copays are the same. The emergency room copay is the same. The difference is the 20% coinsurance and the higher deductible and out-of-pocket limit. And then the last of these kind of plans is our PPO 70. Again, in and out of network benefits, the 70 means that you will pay 30% after you've reached the deductible. The deductible is a little bit higher. The out-of-pocket limit is a little bit higher, but the copays are the same. So now let's take a look at Kaiser. Of course, Kaiser has no out-of-network benefit. So we're just going to look at the network. This plan is the EPO High, which is very much like the Anthem PPO 100 because it has no deductible, a fairly low out-of-pocket limit, and low copays. And again, you don't worry about a deductible with copays. You just pay that copay every time you get service until you reach your out-of-pocket limit. Kaiser also offers the EPO 80, which is very much like the Anthem PPO 80, meaning that you're going to pay 20% coinsurance once you reach this fairly small deductible. And the plan's going to pay 80%. And once you've reached your out-of-pocket limit, then the plan will pay 100% of your covered care for the rest of the year. So now let's take a look at the high deductible plans. And I do want to spend just a minute on these if you're not familiar with them so that you can see how they are different from the PPO plans or the Kaiser plans. The first difference, as I mentioned earlier, is that the deductible is generally higher. And the other most important difference is there are no copays. You can see there are no copays on this chart. So remember, when you have coinsurance, you first have to meet the deductible before the plan begins to start making its payments. That means that you're going to pay 100% of the agreed upon cost for care, the negotiated cost of care, until you have paid out of your pocket $1,650 if you are in an individual plan. And then you'll start paying 15% of whatever the cost of service is until you've reached your out-of-pocket limit of $2,400 for an individual plan. Remember, those numbers sound scary, but you have the money in your health savings account, which your employer is helping you to collect to help you pay these costs. The next one, the most common one we have, is our CDHP 20. And as you'll see in a minute, we offer this one both through Anthem and through Kaiser. So if you like Kaiser and you want to be in a high deductible plan, you can do that. You can see that the deductible is a little bit higher and the out-of-pocket limit is a little bit higher. And the coinsurance, instead of being 15%, is 20%. So now, once you've reached your deductible, you're going to pay 20% of the cost of the service that you're getting until you've reached your out-of-pocket maximum. And just a reminder, if you go out of the network, you can see you still have the same kind of coverage. You're just going to pay more out of your pocket. It's going to cost you more. So this is the Kaiser CDHP 20, and it is exactly the same as the Anthem one. And then we have one other high deductible plan, and it is our Anthem CDHP 40. Notice again that the deductible is a bit higher, the out-of-pocket limit is a bit higher, and now you're going to pay 40% of the cost of your care after you've reached the deductible. But notice, of course, like with all of our plans, that your preventive care is costing you nothing. So you don't worry about a deductible. You get your annual physical and all of those age-appropriate tests every year without any cost to you. If you want details about any of these plans, you can find what's called a summary of benefits and coverage for each one of the plans on our website and also on the Diocese of Los Angeles's website. And if you look at this 8-page document, it will give you the details about what the deductible is, what the out-of-pocket maximum is, what's covered, what's not covered, how much it's going to cost you for various different kinds of services. And by how much it's going to cost, I don't mean the specific dollar amount. Mostly it means the copay or co-insurance that you're going to pay. But the details are there. And remember, one really good way to compare plans is to look at the out-of-pocket maximum, because that's how much you can be at risk for having to pay out of your pocket during a high medical need year. So none of that is changing. I just wanted to go through it quickly so that you understand how the plans work. What is changing is we have a new benefit that's added to all of our plans, all of our Anthem plans, but not our Kaiser plans. And that's because Kaiser, as a system, already does what we're adding with Quantum Health. Kaiser takes care of their people all within the same system. You know where to go for questions. You know how to find the services that you need. Anthem, we have really been on our own. I've been enrolled in an Anthem plan for years, and I have to find my own information. So now we're adding this service called Quantum Health. And it is a service that is going to allow me and you, if you're enrolled in one of these plans, to answer questions like, I don't understand this claim. I don't understand the bill I've gotten. I don't know what my plan covers. I need a new ID card. I need you to verify that I actually am going to get coverage, helping me to save costs on any of this. Maybe they have ideas about how I can save money. It's one number to call to get the kind of coordinated care that the Kaiser network provides now. This is not to get in the way of your relationship with your doctor, because you will still have that relationship, but it's if you have questions or if you need assistance navigating the system, Quantum Health is going to be there. I did have a video, but I'm not going to show it. Just see if we can get out of there, because I'm having trouble with there we go, with the sound. So again, Quantum Health is going to be your one place to call, and you will get a copy of these slides, or it will be on the diocesan website, so you don't need to write this down. You can just go to the website and find it. But you can call them, you can register yourself with their website and access through the website, or they have an app that you can use. And again, it's the one place that you're going to go to answer all of the questions you have about your care and about the healthcare system in general. That support is going to start in January. But right now, if you're using the Anthem network, you can access Quantum Health by calling them to help you figure out what plan might be best for you. Understanding what the options are, what you should be looking at, what your specific situation is, you will be able to call them and they'll help you walk through that process. The most important thing to know is that you're going to get a new ID card. It will come in December. You're going to use it in place of your Anthem card. Your Anthem card will not work starting January of 2025. So you'll need to give your doctors, any hospitals, laboratories, also your pharmacy and Express Scripts, this new card, and it's going to have a new ID number on it. So make sure that you look out for that card and use it starting in January. I can't make that strong enough. Your old cards will not work. You will not get a new dental card. Nothing is changing with dental, which we'll talk about in just a minute. This is an example of what the card's going to look like. It'll still say Episcopal Church Medical Trust, but it's going to have MyQ Health on it. That's Quantum Health. And it will have information on it about how your providers can bill their claims. So it's the new card you need to provide. Okay. Let's talk quickly about mental health and substance abuse. This benefit is not changing. You have it in your plans now, both through through Anthem and through Kaiser. It's not changing, but what does change is if you need help and you're in an Anthem plan, you're going to contact Quantum. Help finding a provider, help just navigating the whole healthcare system, the mental healthcare system. You're going to call Quantum instead of Anthem. If you're with Kaiser, you're going to continue to call Kaiser, of course. And you still will have access to our EAP. And the EAP stands for Employee Assistance Program, is provided in all of our plans, including Kaiser. It's a separate program that we've added to all of our plans, no cost to you. It's there, and it is through Cigna. It provides a lot of service and benefit for you, including counseling sessions at no charge, but a lot more. So if you are in an Anthem plan and you want to get assistance through the EAP, you're going to call Quantum. That's kind of the common refrain. You're going to call Quantum for most of what you need. If you're in a Kaiser plan, you're going to continue to call Cigna, just like you do now. You also have access through the EAP to online therapy through a thing called Talkspace. We found throughout the last few years that in some of our more rural locations, it is hard to find a mental health therapist with which to talk in person, or to find one that will even take insurance. So we have now this service where you can access a qualified mental health counselor through the EAP by telephone or by video. And it's not an additional cost. It'll cost you the same as using EAP in person. So you have that. Your pharmacy benefits are not changing. They are the same next year as they are now. But I just want to make sure you understand about your pharmacy benefits. Keep in mind, the cost of what you pay for your medication depends on the kind of drug it is, whether it's a generic drug that's been on the market a long time and is very inexpensive, or a brand name drug. And in a minute, I'll show you a chart and you'll see how the cost does increase as you move up from generic through brand name drugs to specialty drugs. And then you can get your medications through your local retail pharmacy or by home delivery. If you are in an Anthem plan, your pharmacy benefits are managed by Express Scripts. And again, if you have questions about your benefits or have concerns, you're going to call Quantum. To actually manage your prescriptions, you will work with Express Scripts. But always remember to call Quantum, and if they need, they'll refer you over to Express Scripts. With the Express Scripts program, we do require that you use the generic medication if one is available. You can, of course, always use a brand name, but you'll just pay more for it. And we also require that you use the home delivery service, the mail order service, if you're in a maintenance medication. That's the medication that you take every day, like for high blood pressure or high cholesterol or depression. Those kinds of medications are way less expensive if you use the home delivery service. So our plan does require you to do that. If you're in a Kaiser Permanente plan, you know how your prescription drug benefits work. Nothing is changing. You have to get your drugs through a Kaiser pharmacy. And this is what the plans look like. If you're in Express Scripts plan, you can see the generics cost you up to $10 at retail, and it gets more expensive as you go down. And it's cheaper if you're in home delivery. So for example, a generic drug at a retail pharmacy is up to $10 for a 30-day supply. But if you're in home delivery, you pay up to $25 for a 90-day supply. So you can see it is less expensive to go that way. I want to talk just briefly about the high deductible plans and how the pharmacy benefits work. You recall that in the medical plan, there was a deductible and then co-insurance and then a maximum out-of-pocket. Well, that deductible and the out-of-pocket includes both your medical costs and your prescription costs. So you have to reach your deductible by paying 100% of the negotiated cost of service or medication. Reach that deductible, and then you start to pay for your medication, the percentage that you see here, 15% for a generic. And of course, always until you reach the out-of-pocket maximum, after which your covered services are no cost. So that's the CDHP 15. It works the same for our other CDHP plans, but you can see the deductible again is higher. The co-insurance numbers are the same, but the deductible is a little higher. And of course, the out-of-pocket maximum is higher. The CDHP 40 again. And if you're in a Kaiser plan, again, you know how the prescription benefits work, but you can see here that if you're in the regular Kaiser Permanente plans, you have pretty low copays. It's cheaper to use the home delivery, but you're not required to by Kaiser. And then, of course, Kaiser's high deductible plan, the CDHP, works the same as the Anthem PPO just through Kaiser. Again, you have to meet the deductible with a combination of your medical costs and your prescription costs. Then you start paying a co-insurance until you reach the maximum out of pocket. Another thing that is not changing is that you have vision benefits through the iMed network. It'll cost you nothing for your annual eye visit. And it's not just for vision correction. We encourage you to get an annual eye exam to make sure that your eye health is good. And if you need vision correction, there is an allowance for frames or contact lenses up to $200 and then discounts on other services. So this benefit is in all of our plans, including Kaiser. If you're in Kaiser, you're going to continue to call iMed to get help. If you're in Anthem, of course, you're going to call Quantum because that's the new service. You will continue to have access to hearing aid benefits in all of our plans, the Anthem plans and the Kaiser plans. Maximum of $3,000 every 3 years, a benefit there. You will continue to have access to our Hinge Health program. And this is a wonderful program that gives you access to services for musculoskeletal issues. And it has saved many of our members a lot of money because they've been able to handle their issues without need for surgery or more drastic programs. If you're interested in that, you can find information on our website. You have access to this now. You will continue to have access to it. Talk a little bit about telehealth. Right now, if you are in an Anthem plan, you have access to Live Health, which is an Anthem platform that gives you access to board-certified professionals, but not necessarily your doctor. And you would connect with them with a computer or telephone or however they're going to do it. Since we're moving to Quantum, we're not going to be using Anthem's platform anymore. Now, if you want to use telehealth, you will contact Quantum and use their Teladoc service. If you're in Kaiser, Kaiser has its own platform, so you'll just continue to use that. Now, remember, this service gives you access to board-certified physicians, but not necessarily to your doctor. This is just to remind you that it's no longer contact Anthem, but contact Teladoc through Quantum Health. On the other hand, if you want to talk to your doctor, but you can't make an office visit for whatever reason, you can do that. You can contact your own doctor and have an online appointment with whatever medium your doctor uses, telephone or Zoom or Skype or whatever. You can do that. And in both cases, either Quantum or Kaiser or your own doctor, if you're having a virtual visit, you will pay whatever your plan says you pay for an office visit, whether it's a copay or co-insurance. No different than just a regular office visit. With COVID, we have in the past said that there is no payment for the evaluation, testing, or treatment of COVID, and that will continue. We have in the past said that you could have virtual visits for COVID at virtual visits for COVID at no cost, and that will continue. The only time you will pay for virtual visits, whether it's with Teladoc or with your own doctor, is if it's not for COVID. So we continue to provide all COVID-related services at no cost, regardless of what plan you're in. I just said that, so this is just a reminder of that. So just remember, if you're in an Anthem plan, contact Quantum. If you're in a Kaiser plan, contact Kaiser. You will also continue to have access to United Healthcare's travel program, which is not a financial benefit in the sense that it won't pay for your medical services while you're traveling, but it will give you assistance. For example, if you need to find an in-network doctor or hospital or the closest emergency room, or you need to replace your lost travel documents or any of that kind of stuff, you have access to that. You will contact United Healthcare to get that regardless of what plan you're in. Another thing that's not changing are your Delta dental benefits. Not changing. The cost is going up a little bit, but the plans themselves are not changing. You will continue to have access to 3 cleanings and screenings a year at no cost. That's the diagnostic program that we provide. No cost for you to get any of your annual services. And with dental, it's 3 times a year. This is not under the Quantum Health program, so you will still have your Delta Dental card. Nothing is changing that way. One thing I do want to make you understand, or make sure you understand, this is not different, but it is something you need to understand. In medical insurance, we have something called the maximum out-of-pocket limit, and that is how much you will pay out of your pocket at the most during the calendar year. In dental plans, there's something called an annual benefit limit, and this is the maximum amount that the plan will pay for your services during the year. So it's an important way to compare plans. So we will continue to offer you 3 levels of plan. This one on the screen is the premium plan. And under each one of these 3 levels of plan, you have 3 different ways to get service. You can always go to a dentist that's out of the network, that doesn't take Delta Dental. You're always welcome to do that. And on the far right column, you can see what your benefits are. You'll pay a co-insurance, there's an annual benefit maximum, a benefit limit. But if you want to go to a Delta Dental dentist, you can go to a dentist that is in one of the 2 networks that Delta Dental has. And so if you have a dentist that you like, just ask them which of those networks they're in. If they're in the Premier network, you can see that your annual benefit limit is a little higher than an out-of-network dentist. And if they're in the PPO network, it's an even higher benefit limit. But between the 2 networks, the PPO network and the Premier network, the cost share is the same, meaning that you're going to pay the plan is going to pay 85% of your basic fillings and things like that, and 85% of major services like crowns, and 50% of orthodontia. So the only difference between the networks is what is the annual benefit limit. That's the premium plan. If you're interested in the comprehensive plan, you can see again, you have out-of-network benefits, but if you stay in the network, you have a little bit less of an annual benefit limit than the premium plan, but both of these are higher than the benefit limit for out-of-network. And the difference here is that your major restorative services go down to 50% co-insurance instead of 85%. And then the other plan is the basic plan. And this one, of course, the annual benefit limits are lower in all 3 stages, and the co-insurance is lower. But nothing is changing with dental. If you're happy with your dental, then you don't need to do anything. If you have any of these conditions or diseases, you get additional benefits from Delta Dental at no extra cost to you. So if you have any of these, please contact Delta Dental and enroll in this program. You can find the information on our website. So let's quickly remind you how to do your annual enrollment. Remember that you can do this every year, and you should do this every year at this time. It's a time to take a look at what you project you're going to need or your family's going to need in the coming year. And does the plan that you're enrolled in now meet those needs? And if not, what are some of the other options you have? And how do you make those decisions and look back and forth between the plans? Now remember, during this time, you will be able to contact Quantum Health to help you understand the different plans and what your options are and how they might work for you. So first thing you need to do is learn about your options. That's some of what we've done here today. But you can also go on our website or on the diocesan website and get information about the plans that are available, about how to access our services. You can download lots of information on our website and on the diocesan website. Take a look at what you need, whether the co-pays, co-insurance, out-of-pocket limit, deductibles, whether they meet what you think you're going to need in the coming year. And then you're going to go into our system. Now, you should have received last week a letter that came in this lime green envelope with information about enrollment, how to access the enrollment system. If you didn't receive it, or if you threw it away, or if your dog ate it, then you can call our client services team, and I'll give you that number in a minute, to get the information you need. But take that envelope. You're going to go into My CPG Accounts, access the system, and make your plan selections. Now, this is not different. If you did this last year, it's the same this year. If you are new during the year, or if you've never done this, you will have to set up an account with My CPG. And if you go into the system, which you will see in the letter you got, it will explain how to set up the system. Then you'll get in there. You'll make sure that we have all of your personal information, like your address and your phone number and your email. We never send you marketing material, but we may need to contact you for something at some point. So we need to make sure that we have the correct contact information for you. So check that. Check your beneficiaries. Check everything that you can, and then make your plan selections. Make sure that you enroll your dependents if you intend to do that in medical and dental. And then save a copy of the confirmation. You don't need to send that to us. You don't need to give it to your employer. You don't need to send it into the diocese unless they ask you for it. But print off a copy so that you remember what you enrolled in. Now remember, you can contact Quantum Health with all of your questions right now, just about how to compare the plans, but starting in January, about anything that would help you navigate the healthcare system. They have a telephone, they have an app, and they have a website that you'll be able to use. If you're in a Kaiser plan, of course, you're going to contact Kaiser with any questions, and Kaiser also has an app, excuse me, and a website. So please take advantage of that. Express Scripts, if you need to change your prescriptions or your home delivery services, all of that, you can work directly with Express Scripts. It has an app. You can call Quantum with any of your questions about what's covered, what's not covered, what the benefits are, and locating local pharmacies if you don't have a local one. And then finally, you can contact us. This is our client services call center. These are representatives that are on our staff. They're part of our team. They're not a call center that we've hired outside. They are located in our office in New York and across the country to cover all the time zones. So please remember that you can call us if you have any questions. And before I go to any questions that you all have today, I need to remind you that this presentation has been an educational program, not giving you any advice, not giving you tax advice, legal advice, accounting advice, any kind of advice. I have tried to be very clear and correct in how I've described the benefits, but if I've said something that's different than what the actual plan documents say, the plan documents control. So I thank you very much for your attention, and I think what we need to do now, Sam, is maybe stop the recording and then see if there's any questions.